Buenas and Hafide. This first meeting of the Senior Citizens Housing Task Force is hereby called to order. For the record, today is Thursday, October 21st, 2021, and the time now is 10:04 a.m. This meeting were sent on October 14th, 2021, and again on October 19th, 2021. In addition, this hearing was noticed in the Guam and on the Guam Legislature's website. Before we begin with the discussion of items on our virtual meeting agenda, I'd like to first provide some general rules of conduct for all those in attendance. The conduct of this hearing shall be as follows. All must abide by the rules of conduct and quality assurance standards. Please keep your video on at all times and ensure you are in a room with little interruptions and adequate lighting to ensure the participant's face is visible at all times. The task force staff will mute all participants until called upon by the chair. When called to speak, please ensure that you are unmuted and that you are speaking into your microphone. Members of the task force wishing to speak may indicate their desire to the chair through the in-app chat feature or by raising your hand. During a vote on a motion, members of the committee shall show a raise of hands to confirm their vote. In the event of an objection to a motion, committee members shall voice their objection to the chair. Task force staff will then take roll call. Discussion shall be confined to the substance or nature of the agenda. Personal inference as to the character or motive of any member of the task force is not permitted. Any violations of this general rule of conduct will result in removal from the meeting room. I thank you all for your cooperation, and I'm honored to have all of you here for this very first meeting. And for those of you watching at home, Public Law 35-140 established the Senior Citizens Housing Task Force with the purpose of assessing senior housing availability and needs. This task force, composed of government officials, community stakeholders, and housing experts, will be responsible for developing long-term solutions for Guam's aging population. I would first like to express again how honored I am to serve alongside each and every one of you on this important task force. This is an important step toward providing affordable housing and assisted living options for our island's elderly population. Siduos Masi for answering the call to serve. As family dynamics and work responsibilities evolve, the privilege of caring for our elders is not always an option. We must provide housing and care options that allow for our Manamco to live healthy, happy, and fulfilling lives. And with the rising cost of housing for the growing population of seniors on fixed incomes in Guam, this task force recognizes the need to plan to meet the changing needs of our elderly population. This task force will serve for 18 months and meet regularly in accordance with the open government law. We will submit our findings and recommendations to the Guam legislature and the governor, and upon completion of our responsibilities. I'm looking forward to our discussions today and for the work we will embark on to plan for the future for our Manamco. I'd like to ask our committee staff, Mr. Christian Valencia, to take roll call of our members here today.
Senator Amanda L. Shelton.
Half a day, good morning.
Ms. Charlene Nicholas.
Half a day, good morning.
Mrs. Edith C. Pangolin.
Half a day, good morning.
Mr. Ray S. Posner.
Present.
Mrs. Diana S. Calvo.
Present.
Mrs. Lourdes B. Mendiola.
Half a day and buenos dias, everybody.
Ms. Melanie Mendiola. Ms. Phyllis Leon Guerrero.
Buenas, Michelle Perez, proxy for Director Leon Guerrero.
Dr. Margaret Hattori Uchino.
Present, thank you.
Siduos Masi, Mr. Valencia, I'd like to state for the record that we are currently waiting for the following appointments for this task force, and that is a representative from the Guam Association of Realtors to be appointed by Governor Leon Guerrero, and a representative from the Guam Council on Senior Citizens, which is yet to be impaneled. At this time, I am also proposing the admission of the following individuals and agencies as members of the task force. In the development of housing options for our seniors, I believe that it is prudent to include representatives from the Department of Integrated Services for Individuals with Disabilities and from our healthcare sectors. So I have invited the following individuals to join our meeting today, and hopefully with the approval of this task force to include them as full-fledged members. And that is Director Phyllis Leon Guerrero from Disid. And so today we have Michelle Perez, Deputy Director, and Dr. Margaret Hattori Chima, Dean of the University of Guam School of Health. Does the chair hear a motion to approve the admission of these individuals into the task force?
So moved.
Thank you, Mr. Tapasnia. And a second?
A second.
Thank you. There are no objections? Okay, motion passes. Welcome to the task force. At this time, I'd like to invite everyone to introduce themselves and your position. So I'll just go in line of how I see you on my screen. We'll start with Ms. Charlene Nicholas.
Thank you, Senator Shelton. I'm Charlene Nicholas. I'm the Senior Citizens Administrator for the Division of Senior Citizens. So an area of need that we've all identified and see, and we've seen this back in as far back as 2014 was the move to look at assisted living for our elderly and also individuals with disabilities. So part of what we do at the Division of Senior Citizens, we do provide a host of home and community-based services, specifically support services to have our seniors age in place in their homes for as long as possible. And we do this through different services such as our case management or in-home services that provides in-home personal care, homemaker and chore, transportation for seniors to access medical appointments, congregate sites. And we also provide services for our congregate and our home delivered meals and caregiver support services. So we do see this as a growing need. We're very grateful that this task force is convening so we can look at long-term how to support not just our elderly, but also their caregivers so that they can have alternate housing availability. Thank you.
Thank you so much, Mr. Nicholas. Ms. Edith Pangolin.
Thank you. I'm Edith C. Pangolin, the President of Guam Housing Corporation. Our mission here is to assist our community with housing rentals, and also we provide loans, and we do not discriminate just because of age. So that's why we are open to assist all our senior citizens also in regards to loan programs that we have. We have various loan programs that they can avail. They can also have maybe a borrower with them or a co-signer should they be in need to build or purchase a home and get the loan from us. So not to mention in our housing divisions, we do have several monomcos to say that we have about 30% currently renting from our units from both LADA, Asades, and Sagani-Lasan. So that's 30% of our senior citizens are currently our clients. So if they need any help, we always welcome them to come to our office and assist them in any way that we can. So that's where we can assist for the housing side of the house. Thank you.
Thank you very much, Ms. Pangolin. Mr. Ray Tapasnia.
Thank you, Madam Chair. Good morning, everyone. My name is Ray Tapasna. For those of you who don't know who I am, I'm the Executive Director for GURA. We are the 800-pound gorilla when it comes to housing. Currently, we provide a home to about 4,562 families and individuals. Many of them are senior citizens or those above the age of 55. Currently, we have 82 elderly housing units under our public housing program. And we have another 49 down at Guma Tranquilidad. But we also have residents that live within our public housing program that may not be head of household, but are just part of the family. We had proposed some options in the past to build assisted living or independent living type facilities because I was aware that we have assets that are probably not being utilized in terms of highest and best use. Those options are still on the table, but some of my ideas are politically sensitive. So I'm glad we have this task force so that we can talk about it and see whether any of these options are viable, and if not, then maybe collectively we can come up with a better plan. What I want to talk about specifically is Guma Tranquilidad. We have 49 residents down there, but really we believe we can house many more elderly residents if we just get creative and work together. So that's kind of my pitch. I'm glad we have this committee or this task force, and I hope we can do something even way before what's mandated in the public law, because I think if we meet regularly, gosh, I don't see why we can't have a plan within 6 months. So thank you, Senator.
Thank you very much, Mr. Tapasna. Yes, I'm hopeful that we will move very quickly. We have lots of things to discuss. Now, Mrs. Diana B. Calvo.
And good morning. I'm Diana Calvo. I'm Executive Director of Catholic Social Service. We are a faith-based social services agency under the Archdiocese of Agana. And specific to the Housing Task Force, CSS is actually a housing provider through various partnerships with GORA. And we currently have one elderly complex, which is a 10 unit, 1-bedroom complex for individuals 55 years and older who meet the income criteria, which is pretty much on the moderate to low income side of the income table. But we are a housing provider. We have 47 units in total at 5 sites. We also operate 3 group homes for individuals with disabilities, several of which are in the senior citizens age bracket. And we have been providing the housing side of it to these individuals for most of them, from the time they move in to end of life. We're also a provider in the community, as was mentioned by Administrator Charlene Nicholas. We are a government contractor for in-home services, focusing on individuals with disabilities as well as those that are terminally ill, as well as providing response actions to individuals who are homeless, and working with these individuals to place them within the continuum of housing, which begins either at homeless prevention and preventing these individuals from becoming evicted, to housing them in emergency shelters, working with them through the continuum that may include subsidized or unsubsidized housing. We have been strongly advocating for community-based services to keep individuals with disabilities, those that are terminally ill, as well as elderly, in their homes, because that is the most cost-efficient process. But where these individuals do not have natural supports and who do not have services or anybody to provide supervised care to them, there is also an array of other housing options. But one of the challenges that is really pressing on Guam is that most of our clients, and probably the community in general, does not have the economic means to pay for unsubsidized assisted living, if that is the focus of the discussion. Thank you.
Thank you very much, Mrs. Calvo. Mrs. Lourdes Mendiola.
Day, buenos dias, everybody. I'm deeply honored to be part of this task force. My first and foremost concern about assisted living, when we talk about assisted living, I still see dollar signs. A lot of the families here in Guam does not have any income, especially the aging, and if they are with their families, it's very, very difficult because the families themselves may not have the resource to even help. So this housing, my dream, or even the outcome of this task force, if I can contribute, is to help those that are not able until the end of life. Because especially with disabilities and terminal illness, where do they go? It's very difficult as it is, especially during these times, pandemic. I really hope to make a difference. I believe there are resources out there for the elderly housing. From what I understand, it's either underserved, or if it's served, then you have to pay money. So that's where I'm coming from. I like to advocate for the elderly to have housing if they're not able to, if they can qualify for this housing. I don't know, when you say affordable, where does that come in? And maybe not many people like the word subsidize, but I don't know where our Manamco locally, especially here, I've seen a lot of families, and I've been involved in other task force, Senator Rodriguez for the assisted living, but they were only talking about money in order for them to qualify. And I don't see that as a reality for where a lot of these families are coming from. So I was kind of disappointed with that, but I hope to make a difference with this, because Manamcos, they have done their times, and it's now that we need to take care of them. And I hope that when my time comes, when I need housing, that I can be taken care of. I hope my children, but nowadays, even our kids, it's hard for them to take care of them. They need the resource, they need caregivers, they need to go to work. Sometimes they have to quit their jobs. And I know of a lot of people that quit their jobs just to take care of their Manamco parents. And also me as a parent, I have to quit my job to take care of my adult child with a disability, because the services out there are not conducive enough for me to trust to put him in that shelter, because I firmly believe that they need training all around. And it's just, I guess we have to feel comfortable in putting our loved ones there. So they need training, and even if we provide the housing, and if they need assisted services, for example, caregiving, can we be able to give that too, in addition, 24/7? Because my dream also for my children is for them. I have one in a residential group home, not by choice. My adult son is hurting him, so I have to step up to the plate and separate them. So my dream is for my son to come home. I have a home, and I hope that they can live together, even if separate rooms, divide the house and make it into a padded all around so that they cannot hear each other. But I do expect the government to help out and have a caregiver for them 24/7, because that's what they need. Thank you.
Thank you very much, Mrs. Mendiola. Ms. Paris from Disid, or I'm sorry, before you begin, for the record, Mrs. Mendiola is our member from the Guam Developmental Disabilities Council appointed by the governor. Go ahead, Mrs. Paris.
Okay, good morning, everyone. I'm Michelle Perez, Deputy Director of Disid, and I'm actually very happy to be part of this. Thank you for voting me in, by the way. Well, Phyllis, technically. I'm really happy to be part of this task force. I think that we all seem to have the same mindset on what we can do to assist with housing. I think we also need to look at the standpoint of what are the gaps in services for the individuals with disabilities overall, and how we can transition them successfully into the elderly program as well. So we've had several conversations with Mr. Tapasnia with trying to get some facilities and other day programs out there that we can have our individuals with disabilities and their families access, as well as working with Catholic Social Services and Ms. Charlene Nicholas over at Public Health. So I think that it's a great group of people that are going to put their minds together and try and get this program going. And hopefully we can expand it more, not only just for senior citizens, but also within the gaps of the age groups from 19 to 55, 56, which Ms. Diana had spoken about, having some individuals in group homes currently who meet the criteria of senior citizens, but there really are no assisted living or programs, other assisted programs out there for these individuals to move forward and have a quality of life in a different facility or different home. Thank you, guys.
Thank you very much. Dr. Margaret Hattori-Uchima.
Good morning. Thanks so much for adding me to this task force. I'm very pleased and excited, because we all know Diana and I and Mr. Tapasna's staff from GURA, we've been talking about this for well over 5 years, many years. And so we're really thankful, Senator Shelton, that you've convened this group. And it's clear that everybody here has expertise in what we need to do and what the gaps are. So I'm really thankful. It's a great group. But I'm the dean of the UOG School of Health, and we have nursing, social work, and health science programs. But I'm also the project director of a HRSA grant, which is the Geriatrics Workforce Enhancement Program grant. So one contribution that I want to make is to ensure that as you're building facilities or planning facilities, that there's workforce development to staff the facilities. Because clearly we know that beyond we've talked the RN shortage to death, right? I mean, that's so complex. And Senator Torres, great to see her here, has been a strong advocate for retention of nurses. But the caregiver workforce is also an area where there's a huge need, not just the hired caregivers, such as those that Diana Calvo and the Mayor's Council hire, but also the families. Mrs. Mendiola, to hear you speak from your own personal experience, there are so many people that are doing it on their own, learning on their own. And, we do have a caregiver training program that we run through this Geriatrics Workforce Enhancement Program grant. So I'm hoping that I can contribute to that. Prior to moving back to Guam, I had worked in California, and in San Diego, they have huge networks of elderly living facilities, and the whole range from assisted living, independent living, to assisted living, to skilled nursing facilities. And on Guam, we just don't have that range. So I believe, there are a lot of models that we can look at, very successful models, and, see how that could work on Guam. And lastly, I just want to mention that Mrs. Calvo and I, we work very closely together, because she's a clinical site, practicum site for our social work, health science, and nursing students. in all of her group homes. Well, not all of them, but in her group homes. But her and I had gone to Japan to meet with, we were able to tour several facilities in Japan and look at how they take care of their elderly. And we all know that Japan, because of their super aging population, right, has excellent models for geriatric care focused on healthy living, right? Healthy aging. And culturally, the area that we went to has great similarities to our island, very family oriented, hoping to try to assist people to age in place, aging in the home. How do you support the families? But also, having facilities that I was very surprised were very affordable. Diana and I joked that when we get elderly, well, we can only afford to go to Japan and live in a facility there because, facilities here and in the mainland are very, very expensive. And Hawaii also very expensive. So, can we look at those models to see how are they able to create these wonderful living facilities in different varieties, different levels of care for their elderly. And again, they have the similar values to us. But anyway, thank you for including me, and hopefully I can assist.
Thank you very much. And I am Senator Amanda Shelton. I'm the chairperson of the Committee on the Advancement of Senior Citizens and author of Public Law 35140, which established this task force. I'd also like to recognize members of my committee who are joining us here today. They are not live on video, but they're here observing the meeting. And we have Senator Mary Camacho Torres and Senator Jim Moylan. So thank you. One of the items on our agenda today, one of the items on our agenda today for new business is to establish roles and tasks of members of this committee. And this is our very first time meeting. And I'd like to recommend that we table this item until the next task force meeting to get to know each other a little bit more and our different contributions to this task force to be able to make those decisions, if that's okay with everybody. All right. So our enabling statute provides that this task force shall coordinate and oversee any and all efforts of GovGuam concerning senior citizens housing, develop a profile of senior citizens through the most recent data on senior citizen population and housing, identify current and future needs for senior citizens housing and assisted living facilities, assess federal resources available through the U.S. Department of Housing and Urban Development, set public policy goals and objectives to meet the needs of senior citizens housing and assisted living facilities, and create senior citizens housing and assisted living facilities development strategies and action plans. So the next item on our agenda is to assess data relative to senior housing and the current and the future needs. And I'd like to invite member Mr. Tapasnia to speak a little bit about this. I know that in your opening statement, you shared about what GORA is doing, but I think you have so much more information to share with us today.
Okay, thank you, Madam Chair. I'll first talk a little bit about our wait list. Currently, we have 2,876 families collectively on our wait list, and this is including public housing, Section 8, Guma Tranquilidad. Of the 2,876, 408 are actually at the age of 55 or older. And those are just the ones that have actually applied for one of our housing programs. We believe that number is a lot higher, but it could just be an elderly resident living with family. And so that number is not factored into this 408. And then as far as, and I talked about this earlier, with our current tenants in our both our Section 8 public housing and Guma Tranquilidad programs. We have let me see. I don't know whether I have time to break this all down, but we have about 44 at AMP1. AMP1 is located or in the villages of Sinahania, Agania Heights, Asen, and Mongmong. We have 44 that are above the age of 55. AMP2, and these are units in Dotnya, Telefofo, and Inarahan. We have 28 elderly residents. AMP3, which is AMP3 would be Agat, Umatic, Maritza. We have 61 elderly residents. At AMP4, which is Derido and Totu, we have about 80 elderly residents. And collectively with our, just in our Section 8 program alone, we have 805 elderly residents. And then of course, another 49 down at Guma Tranquilidad. So as you can see, we provide a home to many of our residents that are above the age of 55. I just wanted to, because Michelle mentioned that we had discussions, Senator, if I may, we had discussions with Disid regarding the property that they have oversight over, which is right across JFK, I believe. And maybe I'm jumping ahead of everyone, but I just want to say that, you know, this is an idea that we had proposed. Again, some of my thoughts are so politically sensitive, but I just want I want everyone to leave this meeting just mulling this over. This is something we had proposed, is possibly developing that property and using Guma Tranquilidad as leverage. And what we had thought about possibly doing is putting out an RFP and asking a developer, whoever is interested in utilizing the property down in Tumon for whatever purposes, whether it be a hotel or whether it be a convention center, because those are the folks that are knocking on my door saying we want to do this. You know, so build us a multi-purpose facility right across JFK that can house our elderly residents, those for independent living, those with assisted living, and how we plan to fund, or what we had proposed, how we wanted to fund that operation is, you know, it could be a multi-level structure, and then the higher elevated units could possibly be a rental income to support the operations. So, I mean, those are that's a thought that we had proposed to Phyllis and to Michelle. Again, maybe jumping ahead, but I just think we probably, if everybody thought that was a good idea, it's something we could pursue, or we could do more research to see whether it's even viable. I just think highest and best use, you have 49 Manonku down at Tumon, and we could, and the issue with moving them was always they were concerned that they didn't want to be too far away from the hospital. Well, moving them up just up the street would mean they're about the same distance to both GRMC and GMH. We could provide them a facility that would give them all the amenities that they don't currently have. We could have a medical clinic. We could have recreational facilities. We could have, you know, everything that facilities for elderly would have on the mainland, but we don't have it here. And we could provide for not just 49, but literally hundreds more, considering the value of this property. So yeah, you know, when I initially took this job, and I got hammered in the media for expressing some of my thoughts, but I never had a chance to actually say, this is what we want to do. We're proposing to do this because my job is not to take care of 49 elderly residents in Tumon, but to try and figure out how we can house thousands more. And I think that this might actually work. So, I mean, those are my thoughts.
Thank you very much, Mr. Tapasnia, and we certainly want to discuss any and all ideas that we can pursue through this task force. So we appreciate that. I wanted to ask you a follow-up question about the data that you shared, and that is there any way for us to assess an accurate count of the seniors who are on this wait list, who are living with their families? So we know, are they going to be needing assisted living, or are they give us that kind of idea?
Yes, I can ask my MIS team to see whether we can break it down even more in more detail. I think we can. I think we can, because when they complete the application, it's fairly detailed. So if you just give us some time, we could probably have a more thorough breakdown.
Sure, thank you very much. Is
But
there anyone
I
else?
also want to, I'm sorry.
No, go ahead.
But I also want to, alert the committee that on our GUR website, we commissioned back in 2019 a housing and needs assessment study, and I think we spent about 50,000 or more on that study. It's pretty detailed, and it provides information that might be helpful to this committee. It's got a lot of demographics. But if you guys need some toilet reading material, maybe just go on the website and read that, and it'll really give you some information on what our housing needs are on Guam.
Okay, thank you very much, Mr. Tapasnia. Does anyone have any questions or comments for this part of the presentation? Okay, thank you very much, everyone. We'll now move on to our third item. At this time, I'd like to invite Ms. Nicholas and our partners at the Division of Senior Citizens at Public Health and Social Services to provide the task force with some information on current assisted living facilities. Ms. Nicholas.
Thank you, Senator Shelton. So there is some information that I pulled from our grantor, Administration for Community Living, and I'll forward to your office as part of the record. So this is basically on assisted living, and I'll just get straight to the point of this, because Ms. Liu also brought up about the cost of assisted living. So this is an excerpt. Although assisted living costs less than nursing home care, it's still fairly expensive, depending on the kind of assisted living facility and type of services an older person chooses. The price cost can range from less than $25,000 a year to more than $50,000 a year. Primarily older persons or their families pay the cost of assisted living. Some health and long-term care insurance policies may cover some of the costs associated with assisted living. The federal Medicare program does not cover the cost of assisted living facilities or the care they provide. In some states, Medicaid may pay for the service component of assisted living. So this is what I do want to bring to this task force as we explore assets, as we explore ways to make it affordable for those who are truly in need, and those who are on that fixed income and may not be able to, and their caregivers. So this is information I do want to share. So when we look at costs, at least we have this information that is available.
Thank you very much, Mr. Nicholas. Does anyone have any questions or comments? All right, thank you very much. And now we'll also discuss some of the federal resources, which is the fourth item on our agenda, available federal resources. Mr. Tapasnia, if you can touch on this as well, to provide the task force some information on available resources through HUD.
Okay, thank you, Madam Chair. Where do I begin? You know, we this year we had I just recently had our board approve our operating and administrative budget of $98 million, I believe. And then come December, we're going to be allocating about $6.6 million in federal low-income housing tax credits. But actually, that is spread out over a 10-year compliance period, so they're worth about $66 million. We hope that, well, the proposals are currently being evaluated by a committee, and we hope to allocate those tax credits by December. And those tax credits will go towards building more affordable homes. Collectively, under the low-income housing tax credit program, I think we built about 1,100 plus units since 2005. And I'm not certain how many more we'll be able to build with the $66 million worth of tax credits, but I'm sure it's going to be substantial. And to what extent will those apply towards elderly residents? I don't know, because again, the proposals are currently being evaluated, and I haven't even reviewed them myself. But moving forward, I mean, there's nothing to prevent GURA from saying in the next allocation of tax credits, we get about 33 million a year to award. There's nothing to prevent us next year from saying we just want strictly senior housing, and have proposals come in for our evaluation and approval that are strictly to build housing for seniors. It could be primarily independent living or assisted living or whatever we want, whatever we feel the need is. So that's one option. I think it's a little late in the game for to try and make it all senior housing for the ones that are going to be awarded come December. But again, I don't know what those proposals are. It could possibly be all senior housing, and I will know in the next few weeks, probably the next time we convene. But yeah, that's one option that I think is available for us to consider. We also have, and Disid and Michelle and Phyllis are aware of this, we also have units that are currently vacant. We have 5 in Telefofu that we had took them on a tour of, and we could potentially convert that into a facility for assisted living or independent living. Again, whatever we feel there's a huge demand for, as long as we meet HUD's objectives of utilizing it for permanent housing. We had another facility in Tamuning. It's a large house that we had showed Disid, and then we recently started discussions with DYA. So one of the things that Lonnie at DYA is considering using that facility for is sort of a transitional home for kids that are going to end up probably being dealt with by CPS. So that's another option that was on the table. I'm not sure whether it still is, but the point I'm trying to make is we have structures that are available today, and maybe what we need to do is just come up with a plan. And that's why, Senator, I felt that possibly we could literally have something to finalize and present even within 6 months, because if GURA is willing to identify certain units then that's probably the bulk of our challenge in terms of trying to find the capital. If the facility is already in place, we just have to renovate it to whatever specifications we feel is necessary, and then just find some NGO or nonprofit that's willing to operate it. So, I mean, that's kind of my thoughts on what GURA has to offer in terms of what could be potentially federally funded. But yeah, we do have structures that are available, and we do have the low-income housing tax credit projects that are available every year.
Great, thank you so much, Mr. Tapasnia. If you can provide the task force with that listing of the structures available, and we can discuss that in further detail in the next meeting, I think that's a great place for us to start. Yes, Mrs. Calvo.
I wanted to also bring up as a matter of consideration within the HUD focus, and when we're and part of the HUD resources includes a continuum of care monies, which is focused really on homeless individuals, from homeless prevention to permanent housing, whether subsidized or unsubsidized. And two of the greater challenges faced on Guam, but also faced in other jurisdictions, has to do with availability and affordability. Availability is looking at the number of housing units that are available that can be used for various housing options. But the bigger, and so on Guam, and we actually had a short presentation with the Guam Realty Association on the same issue of availability and affordability, because the bigger picture on Guam, based on the clients that when I say we, that would be the Guam Homeless Coalition collectively, when we're working with homeless individuals, is rehousing them, is also looking at affordability. And so just from our own experience, working with individuals, putting them, working with clients who are eligible to be a priority population for the Section 8 voucher, or are able to get into public housing. Access into the housing is one component of the whole emphasis on rehousing. But the bigger picture, and the one that we're continuously struggling with, including where individuals are frail and unable to take care of themselves, is really on housing maintenance, meaning keeping people in the home, whether it's in their own home or in some kind of shelter. It's keeping them in there, most of which is a challenge because people may have various barriers. And as someone is becoming frail because of medical conditions, or the use of untreated mental illness, or whatever the barriers are, then it forces the need for supervised caregiving. And that is one of the biggest challenges that we have with trying to keep people in a home, regardless of what that option is, because people can't afford to pay for rent and they can't afford to pay for a caregiver. And obviously they turn to the government to provide all of those supports, which if there is no federal monies to cover that cost and subsidize it, is GovGuam willing to look at it from an investment perspective, which is what Mr. Tapasnia was bringing up, and how do we then develop a policy that encourages what Dr. Margaret is saying, having a healthy community and being able to age, gracefully and healthily until end of life. And it's really centered around availability and affordability. And so that's just as a matter of consideration, because the government has invested a lot in building these assets. So we have Guam Housing's assets, we have GUR's assets, we have Chamorro Land Trust's land assets, and then GovGuam departments also have properties that are probably not developed. And correct me if I'm wrong, with the land management, but government agencies have had some properties allocated to them. And I know that there's been some kind of inventory that may have been started a long time ago about where these government properties are and whether or not some of them, whether those land areas, I don't know what's the correct terminology, are buildable. Because I mean, like, I know with public health, we had properties in Maimai, but it's swamp. So it's probably not a good option to construct some kind of facility there, unless there's a lot of mitigation, to address the sinking, whatever. So it's one thing to construct buildings, but it's another thing to fund operations. And I think that's the other part of the gap, is that the monies that are available are not commensurate with population growth and demand. And so when general fund coffers are low and general fund monies allocation to the departments are at a certain level, then part of the impact is a decrease in services. And assisted living options range from minimal supervision to total care. So there are various levels of care. And in those levels of care, there's various cost pricing. And what would that, I mean, how do we envision for that kind of assisted living continuum to be developed on our island? Thank you.
Yes, thank you very much, Mrs. Calvo. Anyone else have a question or a comment? Okay, we'll move on to the next item on our agenda, which is affordable rates of housing. So I'll call on Mrs. Pangolin and Mr. Tapasnia for this part of the presentation.
I can start, Edith, if you like. With GURA, we're highly regulated in everything we do is premised on HUD mandates. In terms of what it costs to rent a unit from GURA, whether it's public housing or with our Section 8 program, your share of the unit, because we would pay a majority of your rent. Again, it's all premised on what HUD requires. And it's primarily contingent upon the size of household and your income. So I can't tell you exactly what those numbers are, because again, it depends on household size and of course your income. But what I can share with you is in some of our public housing units, if you're not, say for example, you're unemployed, it could be as low as $50 a month. But the average would be maybe $200, $250. And then with Section 8, again, depending on the unit size, I've seen the tenant share anywhere between 150 to 250, and then we pay a couple thousand. So I wish I can give you more details, but it really depends on your income and your household size.
Okay, I also like to reiterate that Ray is correct in terms of the requirements. And for Guam housing, we are also based on your income, right? And so most of our units, as I can share with you, we also provide rentals based on income again, and it's like for a 2-bedroom, we can rent it out like for $600. For a 3-bedroom, we rent it out for $650, and a 4-bedroom, we rent it out for $725. Mind you, these are units over at LADA. We are currently working with a contractor to renovate 23 of our homes. And as a result of that, we are looking at all of them probably to be GURA compliant. We do get vouchers. Our tenants are also from GURA. And so we need to meet the requirements of being compliant from GURA. So as a result of that, we also are looking at possibly repairing. Granted, we do have funding. We're seeking help, hopefully to get funding to probably do some repairs to our SUDIS units. And those are only 2 and 3 bedrooms currently in Jigo. It's only 50% occupied. We have 212 units. And so we're working with the front office, hopefully that there can be some means to assist us. We don't have means to make repairs, but gradually, hopefully, in the very, very near future, we can be able to get some funding assistance. So in the meanwhile, we do have those 23 units that will soon be renovated and will occupy them, but there's still some 14 remaining that still also is in dire need of repair. We only have a total of 123 units in LADA. It's such an ideal location for tenants because of the surrounding areas. We do have public health, of course. We have schools nearby. So it's such an ideal place. And it's not to mention just for the seniors, but also we're looking at the homeless population. So those are in the making, and I guess we'll have more details on that as we progress. Thank you.
Thank you very much. And those rates that you mentioned, those are rates for applicants or residents, regardless of age. Is that correct?
That's right, as long as it's income driven, income eligibility.
Okay, thank you very much. Any questions or
Yeah,
comments?
Senator, if I may, because Edith mentioned, we've been in discussions with the Guam Housing Corporation regarding those 23 units that they're currently renovating. One of the programs we have is called project-based vouchers, and HUD allows us to project-base our 2,581 vouchers at a cap of about 20%. And right now we only have 112 that are under the project base. So we still have like 300 to 400 more to reach that cap. So what we've been discussing with Edith is the possibility of making those 23 units project based, which means Guam Housing Corporation and GURA would enter into a contract, and we would commit that all 23 units, or whatever number they want, it could be less, could be Section 8 vouchers. And what we had discussed with Guam Housing is for me to avoid having to go through a lengthy procurement process, I could just, if they're able to justify that a portion of those 23 would be committed to homeless veterans, a portion would be ADA compliant for persons with disabilities, and possibly maybe we could even add to that and say a portion could be for elderly residents.
Yeah.
And if we go that route, I would be able to enter into a contract and commit about, anywhere between $800,000 to $900,000 a year specifically on this for those 23 units. So that's one option. Again, maybe jumping ahead of myself because that's not even in a plan, but it's something we can do. Going forward, we don't have to stop with Guam Housing Corporation. GORA can actually commit, again, as I said earlier, about 20% of our vouchers with any private operator if we wanted to just focus on Manamku and persons with disabilities. I've got a cap of several hundred that I can do. And the reason why HUD would prefer we explore project-based vouchers is at the end of every fiscal year, there are units or there are vouchers that we've not been able to issue, primarily because we've issued the voucher, but the family or the individual, whether it be a person with a disability or an elderly resident, is not able to find a unit. There's a limited housing stock for one. That was mentioned earlier. And in some cases, some landlords are not comfortable with contracting with GORA for Section 8, which I think after or during this pandemic, they found out, or many landlords found out, that it doesn't matter if somebody loses their job or it has a reduction in hours, GORA will pay, and GORA will pay on time. So I think landlords are starting to realize that if you're just renting to Joe Public and they lost their job, you might not get paid. And if you had considered GORA previously, you will get paid. So, but in short, there's the project-based voucher system. Diana mentions our continuum of care grant. We get about $1 million a year. I didn't mention that because it's not a lot of money. I was kind of talking about the big projects, so we can have a greater so this task force can have a greater impact. But there's a lot of programs, and I think collectively we can make it all work more efficiently with everybody's help here. But again, that's what we're talking with Guam Housing Corporation, and as I said earlier, with Disid, there's a lot of options on the table where I think if we put our collective minds together, we can actually come up with a plan that will end up showing some tangible results.
Absolutely. Thank you very much, Mr. Tapasnia. So does anyone have any questions or comments for this? Yes, Dr.
So,
Tori.
I'm honestly, I'm not good with I don't understand the insurance system on Guam, but, I just wanted to bring up that, in the future, if the idea of long-term care insurance is something that the insurers on Guam would consider, because I know in many of the states, you do have the option of buying long-term care insurance. Granted, I don't even know the cost if it's expensive or not. But at least for some people that is an option. But I know we don't have that here. Then the only other thing I wanted to bring up, just so that we don't forget it, because I would forget it, is that as we're looking at facilities, in light of the current COVID-19 pandemic, many people are aware that in the States, the long-term care facilities were hit the hardest, both in terms of staffing and then in infectious diseases. And with our geriatric grant, we collaborate closely with Hawaii's Geriatric Workforce Enhancement Program, and they've been doing a lot of training of staff in assisted living, as well as in long-term care facilities. So just as we're moving forward, we need to remember that environmentally, we need to take into consideration not just the current pandemic, but of course, any kind of environmental mitigation, which, Diana Calvo's expert in facilities, but that has not been something we've considered in many of the current long-term care facility designs. So just to bring that up, because I'll forget. Thank you.
Absolutely. Thank you so much. And that's why we're extremely honored to have all of you from these different sectors of our community, healthcare, housing, senior citizens, all of you here with your different perspectives and your expertise to bring those things to the table as we make these considerations for our senior citizens. So thank you very much for that. And I also wanted to bring your attention to the need for us to develop our goals for the work that we will do for the master plan that we will submit in the next few months, and some things to think about before our next meeting for us to set some goals. And that's one, providing housing for our Manamco within stable and attractive communities through maintenance, renovation, and modification of existing homes. And I think, Mr. Tapasna, you hit this quite a few times. With your collaboration between Guam Housing Corporation, I think that there's a lot of opportunity for us to address that right now. And then number two, producing new housing that meets the needs for our Manamco while not detracting from existing neighborhoods. And three, providing affordable and diverse housing to meet the needs of low and moderate income senior citizens. So I think we talked a little bit about this all over from our introductions and our first task items today. And I'd like to open the floor now if anyone would like to give some closing remarks or anything you'd like to bring up for us to work on for our next task force meeting. Yes, Mrs. Calvo.
I think one of the driving forces for a lot of what we're going to be discussing is really focused or centered on economics. And I think one of the big factors is on how rental rates are, either how they are set, and I'm not necessarily, an advocate for adding more rules, but when we're doing market studies to determine, what is fair market rent or rent reasonableness, or whether or not the person that we're working with will have capacity to pay rent on an unsubsidized level, then I think it's really looking at the affordability piece. And given that on an island where everything is imported, and if that drives up the cost, then how can we really develop a plan that's affordable based on the income levels of our community? Because most of our clients right now, even though they had a healthy workforce, their only retirement income is Social Security benefits. And at less than 50% of what their total earnings were or whatever, it is really not enough to pay for the total cost of living, which includes all of the basic needs plus shelter, plus medical. And so affordable rent, I don't know how to define what affordable rent is. What we have is market studies that GURA does, and then the fair market rent is established based on what is GURA or HUD's updated tables, for FMR, for based on 1 bedroom, 2 bedroom, 3 bedroom units, that kind of stuff. While there's a calculation and a formula for all of those, we really need to look at what is affordable for individuals where government subsidy is not available. And if rental income is what we're working with, then what does affordable rent look like? And so that's just something that we could also consider for our future discussions.
Yes, thank you very much for that. Mrs. Mendiola?
Yes, when Mr. Ray Tapasna was talking about the possibility of across the street from JFK, I was just wondering if the housing is to be built there. I imagine if that hundreds of homes for the seniors. I was wondering about the initial plan by Disid for the building there for like a one-stop center for transportation, for the autism center there for the children, for the training center there. This just flashed through my head because throughout the years that was in the talk. And now we're talking about possible building of the senior home. So what is it? Are we, because that was that we're talking big projects there. So are we doing away with that initial plan? Mr. Tapasna, maybe you can enlighten me, or Michelle from Disid. I'm just a layman, you know, I'm just a family member, so I don't know what's going on with the government. Now I really want to find out what are we looking at, and if that's not a possibility for the senior housing, are there other areas on the island for that to be built? And you know, I like to hear the words affordable, and what is affordable, and assisted living, and what does that entail, and what about the low the economic hardships on the family that are not able, and that's true. Sometimes the retirement is only from Social Security. So what is affordable, and what is, will the government be able to subsidize that? Or is there a possibility in the works for improving the senior tranquilidad? I mean, you know, we have 49 down there, and where will the others be coming forward? These are just flashing questions that I, you know, we must work together, and I like to contribute. I don't know how I can contribute, but just to find out information about that. There is a need, identified need for the senior elderly, elderly here in Guam that are not able to afford any kind of housing, especially, and I'm also talking on behalf of the families that are housing their senior families.
Okay, thank you very much, Mrs.
If I,
Yes, Mr. Tapasnia and Ms.
yeah,
Perez.
if I can respond, thank you, Senator. You know, I mentioned that, Mrs. Mendiola, not that there's any concrete plans. I mentioned that option. So I'm hoping this task force would put all options on the table, and let's talk about it, right? Let's debate it. And hope, and you know, the way I operate, the way I run my operation is I try and look at all the lowest hanging fruit, because I'm not going to be here forever. I'm appointed to a 4-year term, which there's a year and a half, and if the governor should stay on, then maybe another 4 years. I don't know what her plans are for me, but I'd like to do as much as I can in the 4 years. And but you know, I also have to recognize that some of my ideas are politically sensitive, and we got to roll it out the right way. But yes, I would hope that everything we talk about is an option that should be considered. And again, as I said earlier, I'd like to pursue the lowest hanging fruit, because some of us don't have a lot of time.
Hi, Ms. Mendiola. Yes, as Ray had mentioned, it was an idea that was brought up to the director about a year or so ago. I mean, you know, they've talked about it, but like he mentioned also, it's just an idea. It's not set in stone. It's something that, you know, he brought up to get all of us to figure out if that's even still an option. So, you know, we'll work as a team to figure out if that's not the best option, like you mentioned, if it is feasible or not. What we just get to find other areas on island that may be more feasible, but it was an option that was brought up.
Thank you so much, Ms. Perez. Yes, we'd like to discuss all available options and ideas here and decide on them together as a task force for what our best recommendations will be to the Office of the Governor, as well as the legislature, to act on policy and pursue these ideas for the future. So I appreciate everything that everyone is bringing to the table. Thank you very much. Is there anyone else for comment or question before we adjourn?
Senator, if I may, one more thing, and I don't want to steal Edith's thunder, but Guam Housing Corp's got, like, Edith, correct me if I'm wrong, 30 some acres up at Asatas of vacant land. And that's something that we've been talking to GHC about as well. But, I'm so happy we've convened this task force, because I mean, we have some on the task force that have vacant land. We have some on the task force that have the potential to use some of their available funding. The Congressman Mike Nicholas issued a press release that there's language in one of the bills before Congress right now that's going to give GURA another $31 million. I mean, I can't see how we can't take vacant land in Gov Guam and then take $31 million coming to us and do something with it, right? So, I mean, I just want to put all options on the table and see which one we can do as expeditious as possible.
Yes, thank you very much. Anyone else? All right, with that, I'd like to announce our next meeting, which will be on November 18th, 2021 at 10 o'clock a.m. We will again use this Zoom platform. I am very happy to chair this initial meeting, and of course, we will address the item on our agenda to choose a co-chair and a chairperson of this task force. So I ask that you keep that all in mind for our next meeting. But I do remain committed to keeping this platform and the legislature's channel available to us so that we can broadcast this live for the public, as well as share our meeting with other members of the Committee on Senior Citizens. With that, I'd like to ask for a motion to adjourn today.
Motion requested to adjourn the meeting for today.
Thank you, Sharon. Is there a second? Thank you, Mrs.
I'll
Mindy.
second that.
Thank you. The time now is 11:21 a.m. and we are adjourned. Be safe, everyone. Siduos Masi and adios.
Thank you.
Thank you.
Thank you.
Thank you.
Bye-bye.